What if your kidney function test came back worse than expected? Would that automatically mean the damage is permanent? Not necessarily. Some kidney problems can improve when the underlying cause is treated. But chronic kidney disease is different, and understanding that difference could completely change how you think about your kidney health. So today, we're separating what may be reversible from what usually isn't, and most importantly, what you can actually do to protect the kidney function you still have. And this is where one number on a lab report can be misleading. One of the most commonly discussed measures of kidney function is eGFR, which estimates how well your kidneys are filtering your blood. But one result doesn't always tell the entire story. eGFR can move up or down, and healthcare professionals often look at the trend over time rather than reacting to one isolated number. So if your number suddenly changes, the next question isn't simply, how do I raise it? The better question is, why did it change? And sometimes that sudden change can come from a problem that may actually improve. One important example is acute kidney injury, often called AKI. This is a sudden reduction in kidney function that can happen over a short period of time. AKI can have different causes, including severe dehydration, infections, certain medicines, or situations where blood flow to the kidneys is reduced. The important point is that AKI is not the same thing as long-standing chronic kidney disease. In some people, kidney function can improve substantially when the underlying problem is identified and treated. For example, severe fluid loss can reduce blood flow to the kidneys. Treating the underlying cause may allow kidney function to recover, but recovery isn't guaranteed, and AKI can sometimes lead to lasting kidney problems. This is why a sudden change in kidney function deserves medical attention rather than a home kidney detox. The goal is to identify what's causing the change and treat that cause appropriately. But here's where things become more complicated. What if your kidney function has been declining, not for days or weeks, but for months or years? That's when we have to talk about chronic kidney disease. Chronic kidney disease, or CKD, is different because it involves abnormalities of kidney structure or function that persist over time. In many cases, established chronic kidney damage cannot simply be reversed with a food, supplement, or detox. But that does not mean there is nothing you can do. Treatment can focus on protecting the kidney function you still have and slowing further progression. Think of it less like repairing a broken machine overnight and more like protecting an important system from further stress. And this brings us to one of the most important questions. If you can't simply reverse established CKD, what can actually help protect your kidney function? If you want to protect your kidney function, start with something that has nothing to do with a kidney detox: your blood pressure. High blood pressure can damage the blood vessels in the kidneys over time, while kidney disease can also make blood pressure harder to control. Keeping blood pressure in a healthy range with treatment when needed can help reduce this risk. But blood pressure isn't the only silent factor that can affect your kidneys. There's another one that often develops quietly for years. High blood sugar over time can damage blood vessels, including the tiny vessels that help your kidneys filter blood. That's one reason diabetes is an important risk factor for chronic kidney disease. If you have diabetes or pre-diabetes, managing blood sugar and getting recommended kidney testing can be an important part of protecting kidney health. And then there's something many people take without thinking twice, especially when they're dealing with everyday aches and pains. Some medicines can affect kidney function, particularly in people who already have kidney problems or other risk factors. NSAID pain medicines such as ibuprofen and naproxen are one example. That doesn't mean you should stop taking a medicine that has been prescribed for you. It means your medications should be reviewed with a doctor or pharmacist when appropriate, especially if you're taking several medicines or have reduced kidney function. But even if your medications are appropriate, there's another everyday factor that can quietly push your kidneys harder: what's on your plate. A consistently high sodium diet can contribute to higher blood pressure, which can put additional stress on the kidneys. And much of the sodium in modern diets can come from packaged and processed foods, not just the salt shaker. For some people with kidney disease, a healthcare professional may recommend specific dietary limits. The right diet depends on your individual kidney function and other health needs. And there's one final factor that sounds almost too simple, but can make a major difference to your overall kidney risk profile. Regular physical activity can help support healthy blood pressure, blood sugar, weight, and cardiovascular health, all factors connected with kidney health. You don't need an extreme workout. For many adults, regular walking and other activities that fit their ability and health status can be a practical place to start. The bigger idea is that kidney protection usually isn't one miracle food or one supplement. It's managing the factors that can place stress on your kidneys over time. So can you actually reverse kidney damage? Sometimes kidney function can improve, especially when the underlying problem is acute and treatable. But when permanent chronic kidney damage has already developed, the goal is usually different: protect the remaining function and slow further loss. And that distinction is incredibly important. If you're worried about your kidney health, don't start with a detox, a supplement, or a dramatic diet. Start by finding out where you actually stand. A healthcare professional may use blood tests, urine tests, blood pressure measurements, medical history, and sometimes imaging to evaluate kidney health. Two commonly discussed measures are eGFR, which estimates filtration, and urine albumin testing, which can help detect kidney damage. If you've never had your kidney function checked, or you have risk factors such as diabetes, high blood pressure, heart disease, or a family history of kidney disease, ask a qualified healthcare professional whether kidney testing is appropriate for you. And here's something important: don't obsess over getting one particular eGFR number. Kidney function can vary, and doctors usually interpret the result alongside your age, health history, other test results, and how the numbers change over time. If you discover that your kidney function isn't ideal, don't automatically blame one food or assume you need to eliminate entire food groups. And don't stop prescribed medication without medical advice. Kidney care often needs to be personalized. Instead, focus on the factors that actually matter: managing blood pressure, managing blood sugar when needed, reviewing medications appropriately, following an individualized diet, staying physically active, and avoiding smoking. And here's the part I want you to remember: you don't need to feel kidney damage before taking kidney health seriously. Early chronic kidney disease can have few or no obvious symptoms. That means prevention and appropriate testing can matter long before someone feels seriously unwell. So, can kidney damage actually be reversed? The honest answer is, it depends on what caused the problem and whether we're talking about a sudden kidney injury or long-term chronic disease. Some kidney function can recover when an acute problem is treated. Permanent chronic kidney damage is different. But even then, there can be a lot of value in protecting the kidney function you still have and addressing the factors that may accelerate further loss. The goal isn't a miracle cure. The goal is informed action. If this video changed the way you think about kidney health, subscribe to VitalBites for more evidence-aware health education. And tell me in the comments, have you ever had your kidney function checked, even when you felt completely healthy? This video is for general educational purposes only. It does not diagnose, treat, or replace medical advice. If you're concerned about your kidney function, speak with a qualified healthcare professional before changing your medications, fluid intake, or diet. Your kidneys don't need a miracle. They need attention before a problem becomes bigger.